Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 24th lecture on Pathology. Today, day 1 of tissue renewal, that is day 1 of healing and repair. Today's topic is cutaneous wound healing and healing of fracture of bone. Cutaneous wound healing and healing of fracture of bone. Before going to discuss about cutaneous wound healing and healing of fracture of bone, we have to know about tissue renewal. What is tissue renewal? Replacement of lost or destroyed tissue. Replacement of lost or destroyed tissue by similar or dissimilar tissue or dissimilar tissue is called tissue renewal. There is again replacement of lost tissue or replacement of destroyed tissue by similar tissue or by dissimilar tissue is called tissue renewal. You know, it was called healing and repair. So healing and repair is nothing but tissue renewal. If you want to define what is healing and repair or what is tissue renewal, the answer is replacement of lost or destroyed tissue by similar tissue or by dissimilar tissue is called tissue renewal, is also called healing and repair. Dear audience, in our physiological condition and in our normal anatomical condition, we need no tissue renewal. Until and unless there is tissue loss or destruction of the tissue, there is need of tissue renewal. Now come to what are the situations where tissue renewal is needed. Again, what are the situations where tissue renewal, what are the situations where healing and repair is needed? The situations are traumatic injury. This traumatic injury may be accidental or this injury may be due to surgery also. So it may be accidental or it may be surgical. Dear audience, if anybody is fallen in accident and if there is injury of the tissue, injury skin or the bones, there is need of tissue renewal. If anybody is under operation and if incision is given in the skin, this is nothing but injury. and this injured area needs tissue renewal. Inflammation. Dear audience, you know inflammation two types, acute inflammation and chronic inflammation. And you also know what is chronic inflammation. Chronic inflammation means active inflammation where tissue destruction and tissue renewal or repair run parallel. So in chronic inflammation, there is definitely tissue loss. And as there is tissue loss in chronic inflammation, there is need of tissue renewal. We can cite an example of chronic inflammation where tissue destruction and tissue renewal run parallel. If you consider chronic osteomyelitis, you know in chronic osteomyelitis there is dead piece of bone, and this dead piece of bone is nothing but destruction of the bone, destroyed part of the bone, and there is new bone formation by the periosteum, and this is called involucrum. And involucrum is nothing but an example of tissue renewal. Necrosis. Dear audience, you know necrosis means some of morphologic changes following cell death in living tissue is called necrosis. So if necrosis occurs in tissue, the tissue is lost, and the lost tissue is replaced by new tissue, and this is called tissue renewal. You can cite an example of necrosis where there is tissue renewal. If you consider liver like this, liver, if anybody suffers from viral hepatitis, you know in viral hepatitis a few number of hepatocytes undergo necrosis. If the patient survives, the necrosed cell are replaced by new hepatocyte again. So this is an example of tissue renewal in necrosis. So these are the situations where tissue renewal or healing and repair takes place. One is traumatic injury, and the inflammation, and there is necrosis. Now come to what are the types of tissue renewal, or what are the types of healing and repair. Regeneration and repair, or fibrosis. Now come to regeneration first. What do we mean by regeneration? It is a type of tissue renewal where the lost tissue is replaced by similar tissue. So replacement of lost tissue or destroyed tissue by similar tissue is called regeneration. So replacement of lost tissue by similar tissue is called regeneration. So in this type of tissue renewal, the lost tissue is replaced by similar tissue. Now come to examples. Regeneration following pneumonia in lung. So regeneration in lung following pneumonia. Dear audience, you know inflammation of lung parenchyma with consolidation is called pneumonia. So if anybody suffers from like this is the lung consolidation. If there is recovery from pneumonia, there will be regeneration. So regeneration in lung following pneumonia is an example of regeneration. Another example, regeneration of hepatocyte following viral hepatitis. If anybody suffers from viral hepatitis, if the patient survives, the cells of liver, the hepatocytes that are lost, again there is replaced by regeneration. Another example is regeneration of epidermal cells following superficial burn. Dear audience, if anybody is exposed to burn and if there is superficial burn, what it means? In superficial burn, the basal layer of cell is present. So following superficial burn, basal layer undergo multiplication and there is regeneration. Now come to repair. What do you mean by repair? Again, tissue renewal is two types. One is regeneration, another is repair. What is repair? Replacement of lost tissue by dissimilar tissue. Is called repair. Again, replacement of lost tissue by dissimilar tissue is called repair. Now come to examples of repair. If anybody suffers from myocardial infarction, dear audience, you know infarct. What is infarct? Localized area of ischemic necrosis due to sudden arterial occlusion or due to impaired venous return is called infarct, and the phenomenon is called infarction. So if anybody suffers from myocardial infarction, if this is the infarct area within the cardiac muscle, this is the ischemic necrosis. If the patient survives, this necrosed tissue is not replaced by myocardial cell, because heart muscle is permanent cell. It cannot multiply, it cannot regenerate. So if the patient survives, this necrosed tissue is replaced by fibrous tissue. So this is an example of repair. Dear audience, now come to cutaneous wound healing. Cutaneous wound healing. What are the types of cutaneous wound healing? Cutaneous wound is healed by two ways. There are two types of cutaneous wound healing. One is primary cutaneous wound healing, and it is also called healing by first intention. Healing by first intention. Healing by first intention. Another is primary. Another is secondary cutaneous wound healing. And this is called healing by second intention. Healing by second intention. So healing by first intention, healing by second intention. Now come to criteria of the wound. Criteria of cutaneous wound to be healed by first intention. Criteria of cutaneous wound to be healed by first intention. First intention. What it means? What are the criteria of a cutaneous wound to be healed by first intention? To be healed by primary healing. The criteria are clean, incised wound. The wound should be clean and incised. Closely opposed wound margins. Minimum hemorrhage from the wound. Minimum hemorrhage in wound. Minimum tissue loss in the wound. Minimum tissue loss. Then no infection in the wound. No infection in wound. Another is there should have no foreign body. No foreign body in the wound. No foreign body in the wound. So these are the important criteria of cutaneous wound to be healed by primary healing. Dear audience, if I want to ask the students, the wound having closely opposed margins with minimum hemorrhage, minimum tissue loss, no infection, no foreign body, and the wound should be clean and incised. Where you can get the surgical wound? The wound is made during incision for operation. This wound is nothing but the wound that is to be healed by first intention. So if a surgeon give incision here, the wound is clean and incised, and following incision, the margin of the wound is closely opposed, and this incision alone, there is minimum bleeding, there is minimum tissue loss, there is no foreign body, there is no infection. So surgical wound is healed by first intention. Now come the criteria of wound to be healed by second intention. By second intention. Lacerated wound. The wound is not clean incised, rather it is lacerated wound. Maximum hemorrhage. Maximum hemorrhage. Maximum tissue loss. Presence of infection. Presence of foreign body. So these are the criteria of wound. These are the criteria of cutaneous wound to be healed by second intention. Dear audience, where we can get such type of wound, where there is laceration, maximum hemorrhage, maximum tissue loss, presence of infection, presence of foreign body, we can get in accident. If laceration of the skin following accident, it will heal by second intention. Dear audience, now come to steps of cutaneous wound healing. Now come to steps of cutaneous wound healing. Primary healing. Dear audience, suppose this is a cutaneous wound following surgery. This is the dermis and these are the subdermal tissue. This is the basal layer of the epidermis. So this is the wound. Following incision in the skin. The first step, filling of gap of wound by blood. Audience, you know, when the skin is cut, there is hemorrhage, and this blood will be accumulated in the gap of the wound. Filling of gap by blood. Then dehydration of surface of wound. Dehydration of surface of wound and formation of scab. And formation of scab. And this scab covers the wound. So this is a scab that covers the wound. Following this, within 24 hours, acute inflammation. Respected audience, you know, reaction of vascularized living tissue to local injurious agent is called inflammation. If the inflammation or the reaction short-lived and there is exudate formation, it is called acute inflammation. And you know, acute inflammation cells are the neutrophil, these are the polymorph. So, as this injury following incision, so this incision is associated with reaction of this living tissue. So there is acute inflammation following incision of the skin. And as there is acute inflammation, what will happen? There is infiltration of neutrophils and there is edema. Why hair edema? Edema is due to exudates. Within 24 to 48 hours, that is on second day, proliferation of basal cells of epidermis at the cut end of skin. So there is proliferation of basal cells here at the cut end of the skin, and due to proliferation of basal cells there is formation of thin layer of epithelium. On third day, replacement of neutrophil by macrophage. Dear audience, you know macrophage is a tissue monocyte and it is called scavenger cell. It plays many roles. These are the macrophages. What is the role of macrophage? On third day in the wound, it engulfs fibrin in the wound, it engulfs RBCs, it engulfs tissue debris. So, macrophage coming in the wound scavenges the fibrin, scavenges RBCs, scavenges tissue debris. So there will be no tissue debris now on third day, and there will be no fibrin threads, and there will be no RBCs. And there is beginning of granulation tissue synthesis. Dear audience, you know granulation tissue is a newly formed mesenchymal tissue composed of proliferating fibroblasts, collagen fiber, ground substance, and is needed for healing and repair. On third day, there is beginning of granulation tissue synthesis. So granulation tissue synthesis begins here. On fifth day, maximum neovascularization. So on fifth day there is maximum neovascularization. So these are the newly formed capillaries, and there is also maximum collagen synthesis. There is maximum ground substance formation. And on fifth day, there is thickening of the lining epithelium, thickening of this epidermal cells, thickening the epidermal cells. Thickening of epidermal layer. So on 5th day, maximum revascularization, maximum collagen synthesis, maximum ground substance formation, and thickening of epidermal layer. And this constitutes the granulation tissue. Now we can say on 5th day, the wound gap is filled with granulation tissue. So on 5th day, wound gap is filled with granulation tissue. During second week, what happens in the wound? There will be no further new vascularization. No further collagen synthesis. No further ground substance formation. And there is disappearance of edema. Disappearance of edema. So this occurs during the second week. At the end of first month, there is development of scars or scar develops. So these are the steps of cutaneous wound healing. Again we recall what are the steps of cutaneous wound healing. If this is the cutaneous wound, initially the wound is filled with blood. Lateral surface deaeration and formation of scab that covers the wound. Then there is acute inflammation, infiltration of acute inflammatory cell, that is neutrophil. Lateral, there is proliferation of the basal cell and formation of thin epithelial layer. Then the neutrophil is replaced by macrophage, and the macrophages engulfs the fibrin, red blood cells, tissue debris. There is initiation of formation of granulation tissue. Lateral, there is maximum formation of new blood vessels, maximum synthesis of collagen fiber and ground substance, and ultimately formation of granulation tissue that fills the wound gap. And there is thickening of epidermal. During the second week, no further neovascularization, no collagen synthesis, disappearance of edema, and at the end of month, scar is developed. This is all about the steps of cutaneous wound healing briefly. Now come to healing of fracture of bone. healing of fracture of bone. What are the steps? Dear audience, suppose this is long bone. The fracture in the shaft of the long bone. What are the steps here to heal this fracture of bone? The steps of healing of fracture of bone. Stage 1, it is called stage of hematoma formation. Dear audience, you know collection of blood in tissue is called hematoma. So if this is the periosteum, there will be collection of blood here. This is a stage of hematoma formation. Stage 2, it is called a stage of traumatic inflammation. What it means, there is a living tissue. As there is trauma, the living tissue reacts, and this tissue reaction of vascular living tissue to trauma is nothing but inflammation. So here there is acute inflammation at the site of bone fracture. And as there is acute inflammation, what will happen there? There will be infiltration of neutrophil. At the same time, there will be formation of exudates. So in the second stage of traumatic inflammation, following trauma, there will be reaction, there will be acute inflammation. Due to acute inflammation, there is infiltration of neutrophils, and there will be exudation, and exudation is associated with the swelling. Exudation is associated with the swelling at the site of fracture. Stage 3, it is called stage of demolition. What happens here? In this stage, the neutrophils are replaced by macrophages. What is the role of macrophages now here? These macrophages engulfs RBC, fibrin, tissue debris, and it also engulfs if necrosis of any bone, a small piece of bone. It also engulfs necrosed a small bone piece. So this is the stage of demolition. So at this stage, all debris are engulfed by the macrophages. Now come to stage 4. A stage of granulation tissue formation. In this stage, at the site of fracture, there is formation of granulation tissue. Dear audience, how the granulation tissue is formed in stage 4? You know, this is the peristeum and there is also endosteum. From the peristeum, and endosteum, what happens? There is proliferation of blood vessels. That is, there is neovascularization at the site of fracture from the peristeal vessels and from the endosteal vessels. Synthesis of collagen from the mesenchymal cells. So collagen from the mesenchymal cells and neovascularization from the peristeal and endosteal vessels, there is formation of granulation tissue. Now we are getting here, these are the granulation tissues. Stage 5, stage of woven bone formation. In this stage, the osteoblast synthesize collagen. Osteoblast synthesize collagen and ground substance. So there is formation of ground substance and synthesis of collagen. This collagen and ground substance makes osteoid. These two makes osteoid. And the osteoid in between the two ends of bone is known as callus. This is callus. What is callus? It is nothing but osteoid in between the two ends of the bones. Later on, callus is calcified. The callus is also calcified later on. Why it is called woven bone? In callus, collagen fibers are arranged as irregular bundles. In callus, the collagen fibers are arranged as irregular bundles. So if this is the callus, the collagens are arranged as irregular bundles. And due to irregular arrangement of the bundles of collagen, it is called woven bone. Why called woven bone? Due to irregular arrangement of the collagens. Stage 6, stage of lamellar bone formation. Stage of lamellar bone formation. What happens here? In this stage, the collagen bundles are arranged as lamellar fashion. Collagen bundles are arranged as lamellar fashion. Lamellar fashion around blood vessel. The collagen bundles arranged as lamellar fashion around the blood vessels, and there is formation of Haversian system. So, lamellar arrangement of the collagen bundles around the blood vessels makes Haversian system. Haversian system. Suppose this is the blood vessel. Around the blood vessel, there is bundles of collagen arranged as lamellar fashion. If this is the cross section of blood vessel, and if these are the collagen bundles arranged lamellar fashion around the blood vessel, this is nothing but the Haversian system. Now come to stage 7. Stage of remodeling. This remodeling is done by osteoclast. You know, this is the osteoclast. These osteoclasts are associated with bone resorption. You know, as it can resorb the bone, it is associated with the remodeling. So this is all about the steps of healing of fracture of bone. Dear audience, this stage 1, stage of hematoma formation, stage 2, stage of traumatic inflammation, acute inflammation, stage 3, the neutrophils are replaced by the macrophages, stage 4, there is formation of granulation tissue, and stage 3, again we recall stage of demolition. Stage 5, woven bone formation. Stage 6, lamellar bone formation. And stage 7, stage of remodeling done by osteoclast. This is all about the cutaneous wound healing and healing of fracture of bone briefly. Today up to this, thanks all.